Hello, I'm Joyce from the Highland Park Senior Producers, and today we have a wonderful guest, Dr. Mark Wyman, who is a retired dentist, and he's going to tell us all about the projects he's involved with now in the organizations. Welcome, Mark.
Thank you for welcoming me, Joyce. Thanks everybody in the studio for having me here. I'm a retired dentist. I practiced for 40 years downtown, and now I'm doing work with the Coalition of Veterans organization, trying to get more dental coverage for our veterans in the VA system. And there are so many reasons why it's important to me and why it's important to all of us that we stand up for this cause. This morning, before we came over to the studio, we were eating breakfast and I had a chance to look at the Wall Street Journal and the Chicago Tribune. And so many of the stories in those two papers dealt with what's going on right now in Turkey and in Syria, and how we're evacuating some very special young people out of harm's ways that are surrounded by 6 different groups of belligerents. These people are in that neighborhood standing up for our freedom. When they come home, it is so important that we stand up for them. And that's why I'm here.
Very good reason. And it's called the Coalition of Veterans Organization?
Yes, it's a very interesting group of people in our group, young ladies and fellas. The leader of our group was in the infantry in Vietnam, recipient of the Silver Star, Airborne Ranger. The second in command of our group was a flyer during that particular period of time. Another one of our leaders was a LERP, and for those who don't know what that means, that means long range patrol.
Oh.
Willie used to go on patrols. They might not see them for 10, 20, 30 days.
Oh, you're kidding.
They would go behind enemy lines. One of the reasons why we think it's more important that we get more dental care for the veterans in the VA system, a lot of these people would go on these long-range patrols behind enemy lines. Sometimes they would be in very sensitive areas, and they could not call in for resupply of food because the enemy would find out where they were, and they would have run out of their C rations. I don't know if we all know what C rations are. So what they would do, if they had the opportunity, they would go to running water, brooks, streams, and they try and get fish.
Oh.
And a lot of times they were successful, and they would be able to nourish themselves with fresh fish.
Would they eat it raw?
Well, lighting a fire had problems. That would give away your position if you lit a flame.
Yeah.
So a lot of times they would eat it raw. I don't know if they had soy sauce, but they would eat it raw.
And they didn't get sick or anything?
Well, see, this is the reason I'm bringing the story up.
Oh, okay. Go ahead.
It would nourish them, and it would give them strength. 10, 15, 20, 25 years later, the parasites that were in this raw fish would start to cause health issues for these kids that had stood up for us when they were very young.
It was still there in them.
Still in their system. Since I joined this veterans organization, I was asked to come down to the south side of Chicago to a meeting of various political leaders. One of the political leaders was the alderman from the neighborhood called Bridgeport. And this gentleman, right out of high school, had joined the Marine Corps, and he'd gone on these long-range patrols. And sure enough, they ran out of supplies, and he ate the fresh fish, and he was very happy when we informed him, you have to be aware if the colors of your eyes start to change and develop a yellowish tinge, because that can be the beginning signs that you're starting to have infection in your bile duct, infection in your digestive system. And if we can intervene quickly, intervention can just be simple dosages of antibiotics. If we wait too long, it can go through malignant transformations, and then all
Really?
heck can break loose.
Oh, wow.
So we accomplished something just by meeting with these people for that one individual alderman.
How did they know that they had the parasites? I mean, how did
That's
doctors?
the problem, Joyce. They didn't, because there was
Oh.
no pain initially.
Oh,
One way we can predict if they're going to have a problem down the road, if you start to get yellowish in the sclera of your eye.
oh, really?
So if we can bring these kids into the VA system for dental care,
Is that the white part?
that is correct. That is correct. And we can examine them, and we can intervene before it becomes a really complicated issue. And that's why this was very beneficial. we
Does
had a
that
chance.
happen to people with liver disease too, the yellow in the eyes?
Same situation.
Oh.
You're very good. Absolutely. The bile duct, liver, the pancreas, they're all in that same neighborhood.
Oh.
And you want to intervene before they become a significant issue. Because then you're dealing with many types of treatments, a lot of times that cause a lot of aggravation and don't always yield the best results. You want to intervene before it becomes a big issue.
Oh, right.
All right, so that was just one specific incident. There are so many different medical conditions that are complicated if you don't adequately treat conditions that exist in the mouth. And we want to make sure that the veterans can avoid complicated medical conditions if at all possible. Now, how did I get in this position? When I was a young person, I was serving in the field artillery at Fort Hood, Texas. And a messenger came out to the field where I was serving, and they delivered to me my mail. And in the mail was an opportunity to come to Philadelphia and interview for the dental school at Penn. It was a great opportunity to try and get into the program, and I interviewed with a gentleman named Dr. Lewis Rose. And Dr. Rose, after my interview, took a big risk. He gave me, and he was involved in giving me a letter of acceptance. And that's when I went to dental school at Penn. 20 years later, Dr. Rose took another big risk, and he wrote a very important paper, kind of specifically pointing out all the different conditions that exist in the mouth that can adversely affect your medical health. And 20 years after that, a lot of this anecdotal evidence that he based the paper on was proven to be true. So many conditions that exist in the mouth can cause so many medical complications. I was brought into the Coalition of Veterans Organization by the group of fellows that I was telling you about earlier. And basically what I bring to the table, I've had 40 years of experience in dental medicine, primarily practicing downtown Chicago. With my experience, if they tell me to go someplace to talk, to try and cause a positive change in terms of giving more dental care for the veterans, I'll jump at the opportunity. In many ways, I'm kind of like their hired gun, and I'm honored to be of use to these very, very professional gentlemen. Another issue that we're dealing with that a dentist can really get involved in is implants. And the reason, and you've probably, and we were talking in the green room before we came here, Joyce. One of the folks behind one of your cameras is from South Africa.
Right.
We had a fascinating experience about 2 years ago. I was invited to a lecture by the world's foremost specialist on implant dentistry. And the dentist that had invited me to this lecture, I guess my reputation preceded me. I was not valedictorian of my dental school class, Joyce, I've got to admit to you. She says, Wyman, please listen to this lecture, because the doctor giving the lecture has only 2 months to live.
Oh,
He has a disease called glioblastoma. And there's not too much to do to help out these folks when they start to really get run down.
Is it a cancer like?
It's a malignancy of the brain.
Oh,
I believe Senator McCain passed on
really?
from glioblastoma. Very difficult to get successful treatment.
Mm-hmm.
Well, sure enough, and this is why it was brought to mind by this gentleman at the camera, we were out with another couple from South Africa originally, and he said, well, you know, I've got a cousin who practices medicine in Tel Aviv, where they're doing unbelievable work in glioblastoma. Sure enough, arrangements were made. This gentleman had a chance to receive treatment where cutting-edge therapy is being rendered,
Mm-hmm.
and he lasted for several years as opposed to 2 months. And we have to be of service wherever we can be. That was just one small example. Many other areas that we can stand up to push more dental care for these veterans that will cut down their medical complications. One area that's very, very important is in orthopedic surgery. So many people that are veterans have had experience over the years participating in sports. All right, when you're young, you participate in sports, you're fine. But sometimes these people that produce unbelievable results at a very high level, trauma is rendered to their joints. As they get older, sometimes the joints start to give out to them on them at a quicker rate than people that had a more sedentary lifestyle. We have an example of a fellow that we treated that was a world-class rower. He competed in the Olympic Games in Munich. As he got older, from the repetitive motion of being a class act rower, caused his joints to give him problems. He was having trouble. He needed joint replacement. All right. Joint replacements are done very, very competently now in the medical community. The problem is, if you have a joint replacement that's working beautifully, but there's inflammation or there's bacterial involvement emanating from the mouth, it can compromise the tissue around the artificial joint.
Oh,
And it can cause an infection that's not really very responsive to antibiotic treatment. A lot of times these joints have to be replaced.
oh,
And anybody that does surgical techniques knows when you have to redo a surgical procedure, it's much more fraught with complications. The initial procedure very, very frequently is much easier to accomplish good results. A redo is much more complicated. Let's head off the need for redos. Let's just maybe cut down on the inflammation emanating from the mouth, the bacterial inflammation going on in the mouth, cut down the need for these redos. We were talking a little bit earlier, and if you don't mind me mentioning, Joyce,
No.
you said you have a type 2 diabetic condition.
yes.
Type 2 diabetic conditions a lot of times make patients much more likely to develop cardiac issues.
Oh,
And you have to just watch the gums so closely.
yeah, I usually go every 3 or 4 months.
God bless, you're doing the right thing. But let me tell you, a lot of these veterans cannot go every 3 or 4 months. Number one, they cannot get the deep cleaning at the VA hospital. A lot of times the VA hospital will send them to the civilian sector, and it's costly
Oh, yeah.
to get it done.
You know, my lady that does the gums, if I was freshly going to her, you have to wait 3 years for an appointment. But I make them like every 3 months for a couple of years in
God bless.
advance.
She's probably very, very competent, very, very good.
She teaches at University of Illinois, you know.
Fine. Oh, that's a statement right there.
Oh, really?
Because you have all your peers keeping an eye on your work.
Oh,
And they let you know if you're not doing it the way it should be
really?
done.
Uh-huh.
Oh, yeah. And I'm so glad you're having the opportunity. I've got to tell you along these lines, because you have the opportunity to go and get this treatment. About 7, 8 months ago, I was practicing in my office, and Rita came in.
Is that your wife?
My wife.
Okay.
There are two fellows in the waiting room that want to talk to you. How long are you going to be with your patient? A couple minutes. We're finishing up,
Mm-hmm.
and then I'll speak with these gentlemen. Finished up, said goodbye to the patient. Everything went smoothly. Everything was fine. And I go out to the waiting room, and there are two gentlemen in the waiting room, a 2-star general
Oh.
and a full colonel. These are two kids that I've known since I was 18.
Mm-hmm.
They did careers in the Army. They came to my office. They wanted to discuss with me ways they can help people coming to them for counsel,
Mm-hmm.
for dental care.
Mm-hmm.
I guarantee you, these two folks, if they need dental treatment, if their families need dental treatment, cost is not really a complicating factor. They can handle it.
Oh.
But people that over the years they had led, had come to them for advice for various issues, they needed advice where to go for dental care, where to go for dental help, how to get dental help. They were concerned and they had come to me for advice.
Mm-hmm.
How can they direct these people coming to them
Mm-hmm.
for advice? And I did the best I could to answer a couple of the questions that they gave me, but they had so many questions. They were very, very interested
Mm-hmm.
in doing their job correctly. I said, guys, I've got another patient I've got to take a look at. Let's get together for a meal.
Mm-hmm.
And during that time, you'll be able to come up with all your questions, and to the best of my ability,
Mm-hmm.
I'll answer your questions. And we did. We got together and we went out to eat,
Oh.
and I did my best to stand
Mm-hmm.
and to think through their problems and give them the best advice I could. And I think it's just so emotional because these people, their whole careers had been used to taking care of the people underneath them.
Mm-hmm.
And even in retirement, they're the same. Certain behaviors don't change.
No.
And that was very emotional to me.
Mm-hmm.
Another issue that's very important to me is cardiac problems.
Oh, yeah.
Oh my gosh. Nowadays, there are so many people with cardiac issues that can be helped
Mm-hmm.
medically. But if you don't adequately take care of what's going on in the mouth, bacteria can be released, inflammation can be released,
Mm-hmm.
and it can cause a lot of the cardiac conditions to take a turn south.
Mm-hmm.
And more treatment has to be rendered. And just like we were talking about with orthopedic surgery, with cardiac surgery, a redo of a valve, a redo of a bypass surgery,
Mm-hmm.
it's much more fraught with complications.
Really?
Oh yeah. Ask any heart surgeon. The first time they would like to do it well and not have to do it again.
Oh, yeah.
For a
friend
million
was
years.
supposed to have a valve, and they told her she doesn't need it now. I know.
Good,
Uh-huh.
good. Let's keep it that way.
Yeah, yeah.
Doctors scare me.
Oh, yeah.
We want to cut down the amount of work they have to do on us.
Mhm.
And one good way we can do this, if we can give more dental care in the
Do
VA
you
system.
believe that medical insurance will ever include dental care? I
It
don't
will.
know.
It will. And you know why?
Why?
I'm convinced if we get out the right information, the great majority of the citizens in our great country
Mm-hmm.
will do the right thing.
Mm-hmm.
And if we can show them, not only are we doing the right thing, but we're doing the cost-effective
Mm-hmm.
thing. A cleaning is very reasonable as opposed to a surgical heart procedure.
Oh, right, right.
If we can convince them that we're going to save a lot of money by rendering dental care for the veterans in the VA system, they're going to buy it,
Mm-hmm.
and we're going to be able to get this mission accomplished.
Oh, very good.
And we've been working
It'll
hard.
be a while, though, yet?
I'm getting
Maybe
trouble
not.
in that area.
Oh, oh.
I was getting ready to come on a show similar to yours,
Mm-hmm.
Joyce. And just before I came on, I got a call from a program I'd been on, the American Heroes channel.
Mm-hmm.
And the producer of the show said, "What is taking so long?"
Mm-hmm.
And I understand her feelings. A lot of the kids that really could use the care are not getting it done efficiently.
Mm-hmm.
Why make them wait after they didn't make us wait
Mm-hmm.
when we needed to stand up and defend our freedom?
Mm-hmm.
And I thought, and Glenda, I said, we're trying, we're moving in the right direction. And all of a sudden, a light just went off. Something had happened in a meeting of our veterans group that week. One of the fellas had asked me to help him write a eulogy
Mm-hmm.
for a person that he knew and I had known. I met him in dental school. He was one of my classmates in dental school.
Mm-hmm.
This person met him at West Point, and he had served in the infantry in Vietnam with this fella.
Mm-hmm.
And he passed on. I didn't know David passed on. He passed on from a disease called multiple myeloma.
Oh yeah, that's a cancer of the.
And a lot
the
of,
blood or something.
you
so-
understand, Joyce,
Yeah.
and there are correlations that have been drawn
Mm-hmm.
between multiple myeloma and lymphomas and exposure to Agent Orange.
Oh. Oh.
So we were, to the best of our ability, we helped write the eulogy for this fella.
Mm-hmm.
And the light bulb that went off in my mind, I remembered when this gentleman and myself were in dental school. The dental school was a military-friendly environment.
Mm-hmm.
I was never in combat in Vietnam.
Oh.
I was not. But so many of my friends were.
Mm-hmm.
And one thing I can tell you, one thing I know for sure, when these folks came back from Vietnam, there were not too many military-friendly environments in the States.
Mm-hmm.
The Vietnam War, a lot of the veterans coming back, in my opinion, were not appropriately welcomed.
Oh. Why?
One-
Why?
There were demonstrations against the war
Oh, I
and
see,
all of
yeah.
this, and a lot of times, in my opinion, the veterans were being made to pay a price
Wow,
for the
really?
times that were existing in our country. But I remembered from my exposure to these people, an area that was a military-friendly environment was my dental school.
Oh.
When I was in the dental school, two of the fellows that were training with me had been chopper pilots in Vietnam.
Mm-hmm.
We had a habit of flying choppers into hot LZs. Do you know what that means?
No.
When people would be wounded, they had to be evacuated quick, even if the firefight was still going on.
Mm-hmm.
And they would call in for medevacs, and they would call in the choppers.
Mm-hmm.
You didn't wait till the firing and the battle stopped. You had to come in and get the kids out of there
Oh. Oh.
so they could be taken care of by the physicians that were behind the lines.
Mm-hmm.
And both of these fellas had been officers flying choppers to evacuate.
Oh, really?
And after getting out of Vietnam and after getting out of the Army, they went to the dental school at Pennsylvania. Another one of my professors had been chairman of the Department of Oral Surgery at Walter Reed, Louis Guernsey.
Mm-hmm.
Jay Siebert had been chairman of the periodontics department at Walter Reed. Periodontics, I think, is similar to what you get, Joyce, when you go to your dentist for the cleanings.
Yeah, I think so.
And I'll never forget, there was another gentleman, Adam Staubholz, who was head of endodontics. Endodontics, God forbid if any of us needs it, it's when you need a root canal.
Oh.
And Adam Staubholz was chairman of the Department of Root Canal
I
Specialty.
get a lot of those.
Okay, well, a lot of people have.
Mm-hmm.
And anybody that's had them done, you know you want it done well. You don't want to have it redone.
Oh, yeah, because once it was infected afterwards or something.
It happens, it
Yeah,
happens.
yeah.
And so you want somebody that really gives you the best effort, so you don't have, you cut down the number of times it gets infected. And I remember Adam Staubholz had been on the line fighting for the Israelis during the Yom Kippur War.
Oh.
And then he came and studied at Hebrew University in Israel, And then we were honored to get him at Penn, to be chairman of our Department of Endodontics at Penn. So basically the point that became very clear to me, my dental school was a military-friendly environment. If we're going to be fortunate enough to cover a lot of these veterans in the VA system, and we do not have enough dentists and enough equipment to take care of them, maybe we can send them to the dental schools. I was talking to somebody else in the green room. They have somebody that we just opened a new dental school in Downers Grove.
Oh, really?
And somebody that we have both heard of, he was a pedodontist, is now teaching there. We're going to be getting more and more dental schools as more and more dental care is needed.
Oh, that's great.
Let's get these veterans over there. Veterans should go to the front of the line after they stood up for us and made tremendous sacrifices for us.
Oh, that's my phone.
That's fine. You know what? It's almost like a fire mission.
Be quiet.
We better make sure everything is secure.
And when I get there, nobody's there.
That's fine. That's fine.
Oh, my gosh.
But I'm just so happy that you gave me the opportunity to stand up.
Yeah,
and maybe
our
mention
time's
some of these
almost
things.
up now. Can you believe it?
Oh, yeah.
2 minutes.
Another thing, too, and I just want to mention this really quickly. I don't know how much time I have, but
2 minutes.
2 minutes. Really quickly, let me mention this. I'm getting a little bit older now. Some of us are in my age range. Our bones are not as strong as when we were younger. A lot of the veterans, my era, the Vietnam era, their bones are not as strong. So a lot of them are going out and they're getting drugs called bisphosphonates that help make the bone stronger. So if they slip on a patch of ice and they fall, the bone won't break.
Oh, because often it does, and that's the beginning of the end. Right?
You know what I'm saying, Joyce. You know the same stuff that I know.
Yeah.
So they take the bisphosphonates. All of a sudden, we came to the realization when patients are on bisphosphonates, if you do dental care on them, significant dental care, they don't heal.
Oh.
All right, we've got to find ways to work through that because you don't want to take them off the bisphosphonates or they're going to have unbelievable complications when they slip. And yet, you don't want to have to slide a little tooth out and give them a life-threatening complication. Let's give the veterans more care in very good environment so that we can properly take care of them.
Do you want, can I give your number out if anybody has any questions?
Of course,
Yeah,
of
what
course.
is it?
I'm retired now, but I'm more than happy.
What number is it? I don't have the right card here.
My cell phone number, where I can always be reached, is area code 312-505-0252.
If they
And
have
I
any
welcome your-
questions there.
Absolutely.
About
I'm
dentistry.
not practicing anymore, but I'd be happy to talk to anybody.
Okay, that's great. And I thank you so much for coming.
And you know something, we didn't even have a chance
I
to
know.
touch on opioids
Or on Rickover.
or on Admiral
You'll
Hyman
have to come
Rickover.
back.
Oh my
Yeah,
gosh.
you have to come back.
Because I know you went to Senn High School, where the Admiral Rickover Academy is, one of our famous people from Chicago.
Yeah.
Thanks, Joyce.
Thank you for coming. Yeah, you must come on. There's just so much more to cover.
Thank you.
Thank you. And so you miss being in private practice?
No.